Hey Modern Manual Therapy viewers, it's Dr. E here. I want to show you a way that I stretch the hip without actually stretching it, and it's a variation on the single leg bridge video that I shot earlier last year. So if my right hip was tight and you kind of feel, you go down for a squat and you feel like a pinching anteriorly, you may feel like you have to stretch out your hip flexors or have someone do like a painful psoas release on you. But one way to actually slack it is to do some repeated hip flexion. So start off with repeated hip flexion, and maybe you can abduct and externally rotate a little bit more if you're still getting a pinch. You can hold it isometrically at the end to kind of reduce that pinch. After that, getting into a lunge position again, and instead of actually lunging to stretch it, if you push against something that's static, let me get a little bit closer. So I'm pushing up against it to kind of activate my hip extensors, and then raise my arm up so I can reach and push drive my heel back into the wall or into the pad. And just concentrate on belly breathing. You can kind of breathe out that perception of stretch if you combine that with the isometric glute contraction. So maybe do that for about 20 seconds or so, and that should really decrease that perception of stretch. And then the next time you kind of test that squat, as long as it's not an actual structural problem, that perception of pinch should be eliminated. Until next time, check out our Modern Manual Therapy on YouTube, Instagram, and Facebook. Subscribe via email so you don't miss any of our awesome blog updates that are updated daily. And check out edgemobilitysystem.com.